Have you ever noticed that your pelvic floor symptoms seem to get worse right before your period comes? More heaviness, more pressure, more urgency, more leakage, and you're thinking, great, as if cramps aren't enough. My name's Dr. Brooke Kolisiak, and I'm a pelvic physical therapist who's passionate about helping people optimize their pelvic health. And I bet you're surprised to learn that your hormone changes can affect your pelvic floor issues. And in today's video, we're going to talk a little bit more about why this is the case and what you can do about it. If you're one of those lucky women who notices that your pelvic floor symptoms seem to worsen right before your period, I want to let you know that you are not imagining things. There is a real reason for this happening. And today I'm going to go behind the scenes and let you know what that reason is. There are three main drivers that affect pelvic floor symptoms before our period starts. The first one is a plummet in our estrogen levels. So right before our period starts, our estrogen levels severely decline. And estrogen is a natural anti-inflammatory. So without it there, our body can become more sensitive to pain and inflammation. And especially in areas where we tend to maybe hold tension, like our pelvic floor muscles, we can start to feel more urgency, pressure, pain, discomfort, fullness in that area because things can be a little bit more inflamed and irritated and sensitive, all because of this change in estrogen. The second driver can be a shift in our digestion that happens because of the hormonal changes. Do you ever feel more bloated, constipated, or even having more loose stools happening right before your period starts? This can be due to the hormonal fluctuation in our bodies. And because of that, it can lead to increased intra-abdominal pressure, which can put downward pressure on our pelvic floor and our pelvic organs, leading us to feel more urgency, potentially have more leakage, feel more fullness, pressure, or heaviness at this time. The third driver of symptom changes right before your period can be a heightened reactivity of your nervous system. With the hormonal changes of your upcoming period, this can heighten our nervous system reactivity and our stress response, which in turn can cause our body to guard and clench, especially in areas that we're already holding tension, which is commonly our pelvic floor area. So we end up kind of clenching and guarding, which can cause more pain and symptoms. And sometimes we don't even realize that we're doing it. It's like our body is bracing for impact and we don't even know that it's happening. Now that we know a little bit more about why this is happening, let's talk about what you can do to support your body both before and during your period to prevent these symptom flare-ups. First, if you're not already doing this, start tracking both your period and your symptoms so we can start to look for a correlation. This doesn't have to be anything fancy. This can be plain old pen and paper where you write down when your period starts and what symptoms you're experiencing, or it can be, a digital format. You can use the Notes app on your phone, or if you have some tracking apps, go ahead and use that. I use my Oura Ring. I also track it in my health app on my iPhone, and that lets me record what symptoms I'm experiencing, when my period starts, and etc., so that I can start to look for any patterns that are occurring so that I can kind of plan accordingly to make sure that I'm optimizing my body for that time of the month. Especially if you are prone to carrying more tension in your pelvic floor and these symptoms tend to worsen before your period starts, it's a really good idea to either start doing or to ramp up mobility and breath work about 5 to 7 days ahead of your period, so that you can start to optimize your pelvic floor for relaxation and recovery and help to get it out of that situation of feeling like it needs to always tense up and be holding all this extra pressure. Some of my favorite breath and mobility exercises are laying down and doing deep breathing, happy baby, child's pose, cat-cow position, simply letting your knees kind of windshield wiper back and forth while you're laying on your back, laying down with your feet up the wall, doing a deep supported squat. All of these are outlined in a pelvic relaxation video that you can access if you go right here just click on the video here and that will take you directly to our guided pelvic relaxation video so that you can just follow along if you're the type of person who likes to follow along. Otherwise, just simply doing 5 to 10 minutes of this mobility and breath work starting about a week ahead of when your period's supposed to start can make a significant difference in reducing the symptoms that you feel during that time of the month. The premenstrual phase is an important time to support your body in reducing inflammation and nervous system reactivity. Here are a few different things that have helped both myself and our clients during this time frame. Magnesium supplementation, especially glycinate or citrate, can help with muscle cramping and muscle relaxation. Heating pads or warm baths can also help with muscle relaxation. Gentle daily movement like walking, yoga, or stretching, making sure that you're staying hydrated and making sure that you have good sleep hygiene, trying to get at least 7 to 8 hours of sleep a night, as well as eating anti-inflammatory foods like leafy greens, salmon, almond, turmeric, ginger, anything in those categories to help decrease inflammation in the body. Some people find it helpful to do a really gentle restorative yoga routine at the end of the night just to really kind of calm things down as well. But these suggestions can help you to manage your inflammation and to manage that increased nervous system reactivity that can tend to happen with the hormonal changes that come right before your period starts. So now I'm curious, are you experiencing pelvic floor symptoms before the start of your period? Let me know in the comments below. And if you found this video helpful, please like and subscribe for more weekly pelvic health tips. And if you happen to be local to St. Louis and want more personalized attention and help, we would love to help you at Legacy Physical Therapy. Do not suffer through your cycle. There are things you can do to help, and we hope you reach out. See you in the next video.